Hello. On behalf of the American Cleaning Institute, I would like to welcome you to the Make Handwashing a Habit webinar. I'm Martha Chapin, Associate Director of Education and Web Services at the American Cleaning Institute, and it is my pleasure to welcome you to this Anytime webinar. During the next 30 minutes, our expert speakers will be providing you with useful information and resources that can help you make handwashing a habit at home, school, and work. Thank you for taking the time to be part of this learning opportunity. We are so pleased to have you registered for this webinar. We value the relationships we've built over the years with you and sincerely appreciate your assistance in sharing our information with everyone that you reach and teach in your schools and communities. This webinar is an Anytime webinar, pre-recorded to be viewable anytime on your schedule. The slides and links included in this webinar are available on our website at cleaninginstitute.org/handwashinghabit. If you have any questions while viewing the webinar, please email education@cleaninginstitute.org. As a special thank you to our participants, we will be giving away 5 baskets of cleaning products that you can either keep for yourself or donate to your favorite charity. The drawing will be December 1st from our pool of registrants. So let's get started and help you make handwashing a habit. This webinar is being sponsored by the American Cleaning Institute. For those of you who may not know us, we were organized in 1926 to teach individuals, families, and communities the true value of clean. Now, as we celebrate our 90th anniversary, we are offering this webinar to continue the tradition of teaching others about the strong connection between good health and good hygiene. We are a nonprofit trade association who represent the U.S. cleaning products market. Members of ACI include formulators of soaps, detergents, and general cleaning products used in household, commercial, industrial, and institutional settings. In addition, we have companies that supply ingredients and finished packaging for those products. Our offices are located in the nation's capital, Washington, D.C. On this slide, you will see our website that we are very proud of, with the priority areas that are managed by our team of experts, which include clean living, science, policy, and sustainability. The clean living area of our website includes numerous resources for clean living at home, school, and at work. Today you will hear from the experts. You'll learn about the science of handwashing from CDC and how handwashing is benefiting the health of families and children globally from our partners at the Global Public-Private Partnership for Handwashing. In addition, you will have the opportunity to learn about the ACI-CDC Joint Initiative, the Healthy Schools, Healthy People, It's a SNAP program, and hear from one of our previous award recipients, the Spanish teacher from McBride High School. We'll review steps to create a handwashing program and how you can apply for national recognition. You will also learn how to access free resources that are available to you. This webinar panel features Dr. Vincent Hill from the Centers for Disease Control and Prevention, Bizan Banavizada from the Global Public-Private Partnership for Handwashing, the 2016 Healthy Schools, Healthy People Award recipient from McBride High School in Long Beach, California, Laura Castillo, and we also have representatives from 2 of ACI member companies, Mark Rundle from Gojo Industries and Fran Glick from Water Journey. Our first speaker will discuss the science of handwashing. Dr. Vincent Hill, Acting Branch Chief of the Waterborne Disease Prevention Branch at the Centers for Disease Control and Prevention, National Center for Emerging and Zoonotic Infectious Diseases. Dr. Hill's research has focused on the development and application of environmental sampling methods, microbial detection methods, and disinfection technologies for water, fecal waste, and hygiene applications. He's the author of over 100 peer-reviewed journal articles and scientific reports focused on environmental microbiology and engineering.
Hello. I'm happy to have the opportunity to talk with you about CDC's work to promote hand washing in community settings. First, let's consider why hand washing is important. Because so many diseases are transmitted by contaminated hands, hand washing is the most important way to prevent transmission of infectious diseases. Hand washing with soap removes germs from hands. This helps prevent infections because people frequently touch their eyes, nose, and mouth without even realizing it. Germs can get into the body through the eyes, nose, and mouth and make us sick. Germs from unwashed hands can get into foods and drinks while people prepare or consume them. And germs can multiply in some types of foods or drinks under certain conditions and make people sick. And germs from unwashed hands can be transferred to other objects like handrails, tabletops, or toys, and then transferred to another person's hands. That's why removing germs through hand washing helps prevent diarrhea and respiratory infections and may even help prevent skin and eye infections. Preventing sickness reduces the amount of antibiotics people use and the likelihood that antibiotic resistance will develop. Hand washing can prevent about 30% of diarrhea-related sicknesses and about 20% of respiratory infections, like colds. Antibiotics are often prescribed unnecessarily for these health issues. Reducing the number of these infections by frequently washing hands helps prevent the overuse of antibiotics, which is the single most important factor leading to antibiotic resistance around the world. Hand washing can also prevent people from getting sick with germs that are already resistant to antibiotics and that can be difficult to treat. There are 5 basic steps for proper hand washing. First, turn on water and wet your hands. Then lather soap on your palms, back of hands, around and under fingernails, and between fingers. Rub vigorously for 20 seconds, about the time needed to sing the happy birthday song twice or say the alphabet. Then rinse hands using clean, running water and dry them with a paper towel or air dry them if an electric dryer is available. Key times to wash hands are when they are visibly soiled, after using the toilet or assisting someone else to use the toilet, after touching animals, before preparing food and feeding yourself or others, after handling raw meat, and before touching your mouth, eyes, or nose. In studies investigating why people wash their hands, the scientific evidence shows that disease prevention is likely not a primary motivator. People tend to be more motivated to wash their hands due to disgust with visibly dirty hands or the perception of being unclean, although often children's stools are not thought of as dirty. There are also societal motivating factors like good parenting, personal beauty and aesthetics, tidiness, and status. Also, in some faith traditions, hand washing is a part of a ritual before prayer, but often does not necessarily involve the use of soap or vigorous hand rubbing. Now let's focus a little on the science behind CDC's hand washing recommendations. Multiple studies have shown the effectiveness of hand washing with soap for reducing diarrhea rates, with studies in the early 2000s finding approximately 44 to 47% reductions in diarrhea. In 2008, an analysis of 30 studies indicated that hand washing was associated with a 31% reduction in diarrhea and 21% reduction in respiratory illness. Recently, another study found a 30% reduction in diarrhea in childcare settings in developed countries and community settings in low to middle income countries. If you would like to learn more about hand washing in schools, here are some web links that provide useful information. Thank you for your interest in promoting hand washing. If you have questions, please feel free to contact us.
Thanks, Dr. Hill, for reviewing the steps for hand washing and the science behind the CDC recommendations. A question often asked is, when is it okay to use hand sanitizer, and when is soap and water better? CDC says that if you are visiting a friend or a loved one in a hospital or nursing home, you should use hand sanitizer before and after the visit, unless the person is sick with C. diff, in which case hands should be washed with soap and water. If soap and water are not available, CDC recommends using alcohol-based hand sanitizer that contains at least 60% alcohol, but wash with soap and water as soon as you can to get rid of germs the hand sanitizer may have missed. Do not use hand sanitizer if your hands are visibly dirty or greasy. For example, after gardening, playing outdoors, or after fishing or camping. Wash your hands with soap and water instead. Our next speaker is Bijan Banavizadeh, a program officer for the Global Public-Private Partnership for Handwashing. In his current position, he supports the PPPHW's work on global hygiene advocacy, coordinates knowledge leadership activities, and assists in the facilitation of the implementation of PPPHW's strategic plan. Bijan holds a Master's of International Development from the University of Pittsburgh and a BA in Political Science from Mansfield University of Pennsylvania.
The Global Public-Private Partnership for Handwashing is a coalition of international stakeholders who work explicitly to promote handwashing with soap and recognize hygiene as a pillar of international development and public health. We are comprised of a number of steering committee members whose primary work is comprised of advocacy and knowledge leadership. The Global Public-Private Partnership for Handwashing works to save children's lives and improve health by promoting the important habit of handwashing with soap. Our aim is to give families, schools, and communities in developing countries the power to prevent diarrhea and respiratory infections by supporting the universal promotion and practice of proper handwashing with soap at critical times. We accomplish this by driving forward, developing, and sharing knowledge to strengthen handwashing implementation, and by building political commitment and triggering action to promote handwashing at local, national, and international levels. Here are 5 important facts about handwashing you may not know. Handwashing with soap is a do-it-yourself vaccine, in that it can protect people from a range of illnesses, and it is a simple action that everyone has the ability to do. Its benefits are far-reaching, as are its impacts, not only to health, but also nutrition, education, and equity. Handwashing with soap reduces the risk of diarrhea by about 50% and pneumonia by 25%. Which are the 2 primary killers of children under the age of 5 globally. This equates to about 1.7 million children in developing countries annually. Handwashing with soap is a cost-effective intervention, specifically in preventing diarrhea and its associated death. In addition to being effective, it is affordable and accessible. Because it is affordable, everyone can do it. Soap is accessible to everyone around the world, but the trick is that soap must be used, which leads me to my next point. Washing with water alone is much less effective, and hand washing with soap can remove germs at a greater rate. And lastly, the critical times that we focus on are after using the toilet or potential contact with feces, and before contact with food or feeding a child. One of our major accomplishments and biggest advocacy initiatives is Global Handwashing Day, which is celebrated annually on October 15th. We founded Global Handwashing Day to raise awareness about the importance of handwashing, which has been celebrated by over 200 million people since its inception in 2008. As you can see on this slide, the 3 objectives of Global Handwashing Day are to foster and support a global and local culture of handwashing with soap, to shine a spotlight on the state of handwashing in each country, and to raise awareness about the benefits of handwashing with soap. So what can you do? Well, there are a number of simple yet effective things you can do or actions you can take to promote handwashing with soap in your community on Global Handwashing Day. The first is to write a blog. Sharing news about handwashing with soap is a great way to educate others about the importance of handwashing, both for health locally and globally. Social media is a great tool to share critical information and create awareness on how to effectively prevent illness. And the hashtag that we use for our messages on social media is Global Handwashing Day. The social media toolkit, which can be downloaded on our website, can provide you guidance on how to draft your messages and has sample messages and tips for tweets, Facebook posts, and blog ideas. You can also host an event. One example would be to hold a hand washing demonstration. Whether at a school, healthcare facility, or community center, you can show people how to properly wash their hands for 20 seconds and educate your audience on the importance of hand washing for education, nutrition, and reducing absenteeism in the workplace. By doing this, you are more likely to get your audience to start thinking about hand washing so that it can become a habit. Please download the Planner's Guide to learn how you can design and measure a successful Global Hand Washing Day event. You can access it on our website. Lastly, while Hand Washing Day is a once-a-year opportunity to make a big splash, hygiene promotion shouldn't end after October 15th. If all Global Hand Washing Day celebrants advocated for hand washing with soap every day, there would be significant progress in moving towards the goal of increasing hygiene programs, investment, and behavior, as well as access to hygiene services. I encourage you to learn more about habits by visiting our website. Thank you, and happy hand washing.
Before I introduce our next speaker, I'll be giving you an overview of Healthy Schools, Healthy People, It's a SNAP program, a joint initiative of the Centers for Disease Control and Prevention and the American Cleaning Institute. ACI has a long history of supporting hand washing in schools. In fact, we've been talking about the importance of student hand washing from our start 90 years ago. Not much has really changed since we published our first report on hand washing in schools back in 1931. We are still talking about behavior, equipment, and products. Past surveys show that people don't wash their hands often enough and they don't wash correctly. So we need your help in encouraging others, namely students, to learn how. The information covered on the next few slides is available at www.itsasnap.org. SNAP stands for School Network for Absenteeism Prevention. ACI and CDC established the Healthy Schools, Healthy People in 2003 to improve hand hygiene habits to help prevent the spread of infectious disease and reduce related absenteeism. This grassroots, education-based effort can help improve health by making hand cleaning an integral part of the school day. The goal of this program is to get the entire school community talking about clean hands by providing tools for incorporating hand hygiene into multiple subject areas and activities. So what's in it for you? Peer-to-peer education works. We have found that involving students in peer-to-peer education is a win-win for schools. Creating and implementing a hand washing campaign in your schools gets students involved in public health. Teaching students the importance of hand washing can impact their health and the health of their families. Improved hand hygiene in schools can lead to improved public health in your community. Submitting your hand washing project can earn your school a national award, which includes national recognition. We send out a press release for your local news, but also to the national wire. And we promote your project at national conferences for school nurses, family consumer science teachers, and other consumer educators like the USDA extension agents. The National Award recipient earns an all-expense-paid trip to Washington, D.C. or Atlanta, Georgia for 3 members of your project team. ACI coordinates meetings for your team visiting D.C. or Atlanta with leaders from CDC, ACI, the industry, and your state leaders. ACI members also supplement the trip with a cash award and hand washing supplies for the school. So how does it work? It's simple. Help your students learn and practice proper hand washing. Have students create a Clean Hands Awareness Project, activity, or campaign, and then send in your one-page summary with photos, videos, or posters or other supplemental materials to ACI by January 31st. A planning guide, national awards, rules, and application form are all on the website. If you need ideas to get you started, check out the photos and videos pages. These showcase ideas from our past award recipients to help you get started. We also share ideas through social media. Be sure to click the Twitter and Facebook links to follow and like us. On the website, the resources page, we have bookmarks, posters to help you advertise the program in your school and community. We also have a Clean Hands Honor Roll certificate that you can give to each person who completes your hand washing activities. The Healthy Schools, Healthy People National Awards Program is open to all public and private K-12 schools in the states territories, and tribes within the U.S., and we've received applications from nearly every state. The 2016 National Award recipient is from California and is our next speaker. Ms. Castillo will be sharing her class's project, Soapy Warriors. Mrs. Castillo began her teaching career in Mexico as a preschool teacher and has also taught PE before moving to Long Beach, California to teach high school Spanish. Mrs. Castillo is a national certified bilingual teacher, ELD specialist, born in Mexico City. She has 35 years of teaching experience, K through 12, in the U.S. and Mexico. She has a Bachelor of Arts degree in Physical Education from Mexico City and a Master of Arts degree in Dual Language Development from California State University in Long Beach. She is also the author of a book written in Spanish for a Mom and Me program in Mexico City. Mrs. Castillo's commitment to her students is to expand their learning through creativity and goal setting, as well as help them to appreciate themselves and others, showing respect for the value of multiculturalism, and that their path of learning will lead them to be a role model while making a difference in their community.
Hello, I'm Ms. Castillo, Spanish teacher at McBride High School and recipient of the National Award for the 2016 Healthy Schools, Healthy People, It's a SNAP program. I would like to encourage my colleagues throughout the nation to take the great opportunity that CDC and the American Cleaning Institute program provides for your students and their communities. The idea of starting a hand-washing campaign to serve the school community came from the curricular unit The Power of the Word from the Spanish textbook. Students were challenged to make real-life connections with the thematic unit. They had to respond questions such as, how do you use your bilingual skills to serve the community? How do we pass on the baton of service to the new generations? Can teenagers be an agent of change? The group brainstormed ideas. The project of hand washing fit the resources and time of doing something simple, however, significant enough to make a change in children's health. Students at McBride High School recognize the importance of hand washing as a basic routine within the health and medical, engineering, and criminal justice pathways. Therefore, it was also a motivator to research and make service public announcements for their peers during nutrition passing period at school. The campaign was planned in both ways, to impact the students' healthy habits in elementary schools and in their own high school. McBride students started the campaign project by electing the group leaders, establishing norms and procedures to disseminate information and roles, and making a calendar of activities. During the second meeting, students decided to create a logo and a song for their campaign. The Soapy Warriors, Los Guerreros del Jabón. It was rewarding to see how collaboration and leadership were leading into a great project. Researching for resources, students found the CDC ACI opportunity to submit their work. The Healthy Schools, Healthy People program promotes creativity and stewardship in its participants. By engaging their community through a well-organized program raising health awareness, students become productive role models for their peers while simultaneously developing a vital set of industry and career skills. As an educator, you will guide your students through this challenge as they take their reins and sharpen their own skills as educators. They will be enthused to discover firsthand the difference that their actions can make in their communities. Encourage them to create and to motivate, as well as to keep track of their progress. Later on, students can reflect on successes and improvements for the next campaign. Whether it's through flyers, songs, or hands-on activities, your classroom success will depend on the enthusiasm and collaboration of the group throughout the process. Don't forget to reach out to local community resources. Involvement from local medical professionals is important to bolstering the efforts of your students. Some websites are willing to provide free training and materials that can be used in your campaign. Remember, high school students are our future leaders. Let's get them ready. And best of luck on your hand washing campaign.
Thanks to Mrs. Castillo for sharing a bit about her students' project. And I echo her challenge to all of you to find ways to encourage your students to create a hand-washing campaign and apply for national recognition. Look for organizations both in your community and online for any resources you may need. Don't hesitate to reach out to ACI member companies like Gojo and Water Journey, both supporters of Healthy Schools, Healthy People, It's a Snap. Gojo was one of the first sponsors and each year contributes to the cash donation that is set to the top school, as well as sending hand sanitizer and hand soap product donations. As a market development manager for Gojo Industries, Mark Rundle focuses on the development and growth of the educational market. In addition to market development, Mark strives to provide schools with the latest hand hygiene education and information on the prevention of classroom illnesses. He has more than 15 years of sales and marketing experience.
Hey guys, my name's Mark Rundle. I am the Market Development Manager for Gojo Industries, and today I want to talk to you about our promise and commitment to sustainability. At Gojo, we believe in setting the standard for sustainable skincare. We have in our portfolio both green certified soaps and green certified hand sanitizers. Our soaps and sanitizers are both plant-based and biodegradable formulations. We can provide both dye-free and fragrance-free formulations, and we have the only green certified hand sanitizer that meets the FDA germ kill requirements with a single 1.1 ml dose. We also believe in providing best-in-class sustainable values. In order to achieve this, we believe in advancing social well-being. This is done through reducing infection rates and absenteeism, delivering and promoting effective hand hygiene, and partnering to support healthy communities. We also believe in measuring and communicating our impacts. We do this through being a responsible partner with published goals to reduce our operational impacts, transparently reporting our progress, and integrating sustainable ways of working. We also believe in setting the standard for sustainable skincare. At Gojo, we have the world's largest portfolio of green certified soaps and sanitizers. We also have products that are designed with life cycle principles in mind, and we have customized support to promote buildings and healthy environments. Thank you guys so much for your time. Have a great day.
Fran Glick is the CEO of Water Journey Limited, a personal care products company whose flagship product is Hands to Go, an alcohol-free instant hand sanitizer. She holds 2 U.S. patents for Hands to Go, and under Ms. Glick's direction, Water Journey has won numerous awards. Previously, Ms. Glick was a VP of Information Technology in the Mergers and Acquisitions Division of Barclays Bank, and before that was a product manager for Unix operating system at Bell Laboratories. Ms. Glick holds an undergraduate degree in computer science from Barnard College, Columbia University, and an MBA from New York University. She is a frequent speaker on topics related to entrepreneurship and women in business, and is the founding member of the ABA Executive Women's Chapter, and remains active in both her alma maters. She is also a past board member of the American Cleaning Institute.
Hello, we are delighted to be here today. My name is Francine Glick, and I am the founder and CEO of Water Journey. And I developed an alcohol-free hand sanitizer called Hands to Go, so I'm the mom you see on your screen. And how did I get about to developing this product? Well, I have 2 children, and I was carpooling them around, and I needed to sanitize their hands. However, one of my daughters has eczema and was complaining that the products that I was using were stinging, and the other one complained that it was smelly and sticky. So I decided there's got to be a better way to do this, and I wanted my kids to clean their hands. So I literally started my kitchen sink working with different ingredients. I was looking for something that was non-flammable, that was non-drying, not smelly or sticky, and that wouldn't sting. And I came up with something, and I thought, if I can use this, other people can use this too. So I worked with a chemist to commercialize it, and ended up with Hands to Go and 2 patents. Um, it's a natural product with only 6 simple ingredients, and we consider it to be the next generation in hand sanitizer. We've been involved in the support of healthy schools, healthy people, I think as far back as 2008, it might go back further. And we've been involved in the development of the program. Every year it gets tweaked a little bit to improve it. We believe that it creates some very, very good habits for children. It's a very fun way for the kids to get involved. And when kids are having fun, then they learn. We've also supported the program through product donations to the winning schools, as well as sending products to the runner-ups. Finally, when we look at hygiene and public health, we think it's very critical to start young. The younger they start, the better it is. We also believe in consistent compliance. We want the children to learn very good habits in terms of hand hygiene, so they have them for the rest of their lives. It's sort of like seatbelts. Once you start to use them, it's very hard to get in the car and not put that seatbelt on. That's what we want kids to do with hand hygiene. Thank you.
Thanks, Mark and Francine, for sharing a little bit about your companies. Water Journey and Gojo are just 2 of ACI member companies. Their contact information is included on the webpage if you'd like to learn more about them or how they can work with your school or organization. And now one last question as we wrap up this webinar. We are often asked about where to find posters and other hand washing materials. ACI has a variety of free educational materials available for daycare providers, school teachers, health educators, community leaders, and students. We have fact sheets, bookmarks, activity sheets, posters, and storybooks. You can download our materials and make as many copies as you need. If you are interested in reproducing our materials, we are interested in hearing how you will be using them. Please email us at education@cleaninginstitute.org and include your name and contact information. You can also order publications online. The ACI website has a complete list and links to the online ordering. Check our site frequently for new and updated publications. We hope the information we covered in this webinar will help you make hand washing a habit in your school, community, or workplace. Go to cleaninginstitute.org/handwashinghabit for additional information, including a copy of these presentation slides, a free toolkit, and links to the free educational materials we discussed. We also have posted the links to resources provided by today's speaker. Thanks to Vincent, Bijan, Laura, Mark, and Francine for sharing some great information in such a short time. And thank you for watching this webinar. If you have questions or suggestions, you can email us at education@cleaninginstitute.org. Until the next time, stay safe, stay clean, and always make each day all about better living.